making my YouTube videos. I know that I said I was going to do a video every Thursday, but life got in the way, so now I'm here to tell you where I've been and what I've been doing. This video is going to be a little different as it's more geared toward individuals who might go through what I just went through, and if you aren't into like the medical stuff or blood, you might not like some of the images in today's video. So stay tuned and I'm going to tell you my story. If you aren't interested in today's video, click away and I will be back with a new either beauty video or hair tutorial soon. So for those of you that don't know or are just watching this video, I have cerebral palsy. I've kind of explained it in another video if you go back through my videos, and I explain kind of what it is, but it affects me from basically the waist down. I have what's called spastic diplegia, so it affects my legs and it causes me to be spastic, which if you don't know what spasticity is, it is where the muscles are tight and spastic all the time. I was born with this. Most people are born with cerebral palsy. If you'd like more information on cerebral palsy, I'll put a link down below, or I'll do another video because this is specifically about my baclofen pump. I want to talk about my baclofen pump today. I recently, well, about a year ago, I changed from a pediatric doctor to a big girl doctor at the University of Kentucky, and I actually was really nervous because I went to that one pediatric doctor since I was like 2 or something. I'd gone there my whole life. And so when I turned 21, I had to go into the big girl world and go to a big girl doctor. And I was scared, but I literally have the most phenomenal doctor in the world. And I'm not just saying that, she's perfect. And her team are just great, and I'm so grateful for them because at the time that I went and saw her for the first time, I had been in chronic pain for about 6, maybe 7, I think it's about 6 years, because the pain started in 2009. And my pain was due to my muscle tightness, so my spasticity that I was telling you about, due to my cerebral palsy. So, you know, we went through a couple options, and she mentioned the pump probably the first 2 times I saw her, and I was like, no, I'm old enough to make my own surgery decisions, not having surgery. No way. Then we decided to do Botox treatment. If you're not aware of Botox treatment for people with cerebral palsy, it helps kind of relax the muscles a little bit. It goes in the legs. Very different from Botox in the face, so don't get that confused. I can leave links down below for that. That's not what I'm here to talk about. So, after 2 of those treatments, the second Botox treatment just didn't work. I'd had them a lot as a kid, and it wasn't working. And I called her and I said, listen, I think I'm going to do this pump. And I said, I want to do the trial, because you do a trial before you do the surgery. We've been on oral baclofen, which meaning taking it in a pill, for 5 or almost the total time that I'd been in pain, and I couldn't take enough to help with my pain because it made me so sleepy. And if you've ever had a drug make you sleepy, you have to have ability to function and to be a part of your life. And it wasn't allowing me to do that, and it wasn't helping with the pain, only temporarily. So she was like, yes, I'm glad that you finally see what I see, and I know this pump is going to be great for you. You know, she knew I was leery, and I think I had every right to be personally, because it is kind of a big deal. And I did a lot of research. I did research online, on YouTube, I joined Facebook groups for people with pumps. I did the whole 9 yards. I actually even watched the surgery on YouTube before I had the surgery because I wanted to know exactly what I was getting myself into. Talking to people who have my type of cerebral palsy, use some of that spasticity to walk. And so I was worried that maybe if I lost a lot of that, I wouldn't be able to walk as well, because one of my physical therapists had the impression that I was going to be in trouble or I would lose mobility if I got the pump. So after talking to several people, I basically just went out on a limb and I'm like, sign me up for this trial. Let me see if it's for me. The trial, I will say that it's kind of scary. I was scared because I'm not a needle person. Hence why I don't want to do Botox injections. So I went in for the trial, and the doctor there was a totally different doctor, not my doctor that I was used to seeing. And he was pretty nice. I liked him. And they took me in. They basically just gave me a shot in my back. A shot of baclofen right in my spine. The only point that I was actually in pain, I guess, from the procedure was at one point I felt this pinch, and it was right in my left butt cheek. I know, I don't know why it was in my butt, because they were poking my spine, so I'm not real sure. But I said ow, and I kind of jumped because I didn't expect to be able to feel anything. And he was like, don't jump. And I was like, well, that was my reflex. So after that pinch, it was pretty much over, and they took me and they monitored me for like 2 hours. They gave me these huge bags of IV fluids in my IV for about 2 hours, because one of the risks of the trial and the pump is losing spinal fluid. Now, it didn't happen to me. I didn't lose any spinal fluid, and the side effect of that is a headache. I got super lucky, and I know that a lot of people aren't as lucky, and I'm really grateful for that. But I didn't get a headache, and we just waited around for a few hours, and then they had me walk, and they wanted me to kind of tell them how I felt about my legs. The doctor that came in after surgery, or before surgery, he examined me, and he wanted to see how tight my legs actually were. Then after, not surgery, the trial, I don't know why I just said surgery. So after the trial, he came back in and he said, I want you to walk. And they didn't feel weak per se, but they didn't feel like my legs. And that was very uncomfortable, because it's like a whole new set of legs. But the thing that I knew instantly was that I was pain-free. It was about 45 to 50 minutes into the trial, and I said, my hips don't hurt. I'm not in pain. And it really just made me think that this is why this is worth it. It's worth it for me to do this just for the fact that I'll be pain-free. And I said, the doctor was happy, I was happy, and I was ready to set a surgery date. So after setting a surgery date, we set one for July 22nd. So on July 22nd of this year, I went into surgery, and I was scared. I'd already met with a surgeon before. I kind of skipped over that part, but I did meet with a surgeon, and going into surgery was scary. I'm not going to sugarcoat it. Maybe, I think anybody would be anxious about surgery. So, let's see, I'm sitting in pre-op, and, they just come in and they mark the side of my stomach that my pump's on. They basically give me some Valium and an IV, and if you've ever had surgery, that's pretty much how pre-op goes. And they just took me back, and they did the surgery. So I have a small incision on my back and a longer one on my stomach, and I'll make sure to add some pictures to the end of this video, or maybe in right here if I can get crafty. It's kind of in my lower back, and then the incision where they put my pump in is on the left side of my stomach. The reason that my doctor and I decided that I wanted it on the side was because I am of childbearing age. I'm in no way wanting to have children right this minute, but maybe years down the road, like years down the road, that's something that I'll be interested in, and I want to make sure that there's room for my stomach to grow, and having the pump on the side is kind of beneficial for that. So after surgery, I woke up, and honestly, I just felt like, I didn't feel anything special when I first woke up. I didn't know how to use my legs. I had no idea because I didn't have any tightness, so I wasn't able to figure out how to move them because I didn't know how. I was not aware of how to move your legs when they weren't tight. That scared me a little bit, but like I said, my doctor, she's phenomenal, and she prepared me for that. And I think that's important, that if someone with CP is watching this and you want to have a pump installed, it's important to kind of talk with your doctor, and I hope that you have a perfect doctor like mine is, and that they work with you and tell you exactly what to expect. Took me to a rehabilitation hospital the same day. I know, I was shocked. I was awake for an hour, and they said, let's get dressed and send you to your rehabilitation hospital. I ended up going to Cardinal Hill in Lexington, which was right down the road from University of Kentucky Hospital. And I got there, and I was not a happy camper. It really hurt to sit up, sit in a chair. It hurt to ride in the car. I was very upset, and I was still nauseous from the medicine, and I'd only been awake for like 2 hours. So that was hard. I got into my room, and I actually knew one of the nurses in my room, at Cardinal Hill, not in my room, but I knew her, and she made me feel right at home, and all the nurses were great. They get you checked in and everything, and, you go through the regular minutes process at the hospital. And then I basically just laid in bed that whole rest of the day. My incision was uncomfortable. I wanted ice so bad for my belly. As far as my back, it just itched. It didn't bother me. And when I post a picture on here, you'll see that the back incision's really tiny, and it's honestly like a scratch. Obviously, it's deeper than a scratch because they have to put the catheter in my back, but it didn't bother me at all. The front incision was so sore, and it was uncomfortable, and I liked ice a lot. And honestly, for the first day, I refused to wear pants. And I wanted to be as comfortable as possible. And honestly, that's what I did. And I was really uncomfortable that first night. I can't lie to you, the first night's terrible. I didn't want to sit up the first day. I didn't want to get out of bed to go to the bathroom. I used the bedpan the first night. But the next day, I felt good. I was pain-free, still pain-free this whole time. As far as my legs, still has that soreness with the scar, but as far as my leg pain was 100% gone. And the next morning when PT came in, I was ready to get up, and I was ready to go because I live so independently as a person with cerebral palsy. And I don't know, I know that I'm extremely blessed as an individual with CP because I have mobility of my hands and my back, and, I'm able to talk, and, I'm so blessed, but I'm really independent. I do things on my own. The only thing that I struggle with is carrying, like, food to the table, just because of balance. So, I walked without my crutches in my house before the surgery, and so I was ready to get up, and I was ready to get back to my independence, but I kind of got knocked down a notch because I didn't know how to get myself out of the bed. And I went from a person that was able to 100% be independent of myself to I needed someone to help me to the bathroom, to get me in my wheelchair. Crutches weren't an option for a long time. And it was hard, I'm not gonna lie, and all I wanted to do was stand up. And they made that happen, thank God. But I will say that after surgery, you're gonna be sore. You know, I went through some times where I was a little nauseous. Thought that was my blood pressure though, so nothing to do with the pump. You know, I was in Cardinal Hill from July 22nd till roughly August 20th, so almost a month. There was a little bit of a break and I was sent back to UK. That was my body's fault, not my pump's fault. And I don't really want to go into that because it was some other complication, not, you know, it didn't have anything to do with my actual pump. It was that my body created fluid around the pump because it was kind of like, oh gosh, what did you just put in me? But as far as the whole pump surgery goes, your restrictions are what is the worst part. You know, you can't bend over, you can't twist, you can't lift over 5 pounds, you can't lift your hands above your head. That was the most frustrating part for me, and not being able to lay on my left side or my stomach was frustrating. But other than that, that's my baclofen pump story. So, I don't know if I answered any questions to somebody that might be getting a pump, but that's where I've been, YouTube. I've been doing that, and the rehab part's been really hard because as someone who used crutches and didn't use crutches in her house and walked around and did her own thing, it was really hard to be in a wheelchair almost the whole time I was at Cardinal Hill. And then the last week I was there, they let me use crutches, and that was life-changing because I felt like I was finally getting back to my normal. And I like to say my normal because everyone's normal is different. So everyone's normalcy is going to be different, and this was my normal using crutches. And honestly, I'm still ready to get back to my normal because using crutches in the house is still happening, and it's frustrating. This whole process, if you're not a patient person like me, it's going to be frustrating. But if you're doing this on a level to get rid of your spasticity and to help with pain so that your quality of life is going to be better, it's worth it. Like, you're going to read things. If you're looking to get a baclofen pump, you're going to read things, and there are risks with every surgery. There are. Even getting your tonsils taken out, there's a risk. Like, there are so many risks for any surgery, and it seems like there's a lot of bad raps with baclofen pumps, not just mine, but with baclofen pumps. I'm really happy with mine. Now, I'm only 2 months in. Ask me next year, I might not like it anymore. But as far as my pain level, I'm 100% off pain meds, period. Like, that's a huge deal for me because I've been on pain medicine for 6 or 7 years. And even before that, I was taking Tylenol all the time, and it didn't really even ease the pain. I'm still going to therapy. I'm still not back to where I was before surgery, but I'm hopeful and I'm being patient. I hope that this helps somebody. You know, the whole purpose of this video, I debated back and forth. I was like, is this too much to share on the internet? Probably. Some people would probably think that I'm sharing too much. However, if you type in baclofen pump on YouTube, you're not going to get quality videos. I'm just going to be 100% real. I like to be honest with people, and this is honesty, you know. You're not going to get a good video on YouTube telling you pretty much everything that's about to happen with the baclofen pump. And this is obviously just what's happened for me. I might not, compare to what you are going through or someone you know might be going through. Please discuss this with your doctor, and not every experience is going to be the same for each person with cerebral palsy, but for me, it has been absolutely phenomenal, and I'm honestly kind of depressed that I didn't get one sooner in my life, because I wonder where I would be now as a 22-year-old if I would have gotten a pump at 16. So, there's always what if, but the pump's been great for me, and I hope that this video helps someone, make a decision, whether it's for you or not for you. I hope it helps you decide. if you all would like to see another video kind of going more in depth or maybe answering some questions about the pump, please comment down below. I don't know if I have anybody following me with cerebral palsy. However, I kind of am hoping to put this on a couple of pages and see if it'll help anybody. As always, if you hear dog whining or barking, they don't like that I'm making a video without them in it. So ignore that, and like I said, comment down below, let me know. I really appreciate you guys watching this video. Please like this video if it helped you or you're okay with me posting videos about my pump and my story, because I know that my subscribers kind of came to me for the pageant and makeup side of my channel, and this is my real life and this is what I'm going through, and I hope that it helps someone out there. I don't know if I have anybody that's gonna see this, but I hope that it helps somebody. Thanks for watching, guys. Remember, you can follow me on Instagram and Twitter and Pinterest. The links are down below. And I appreciate you guys so much. So if you like today's video or any of my other videos, can you please hit that subscribe button? This has become a passion of mine to make YouTube videos. I seriously enjoy it. And if you all were to like this video and subscribe, I would appreciate it so much. Thanks for watching, guys. Bye.